A very good evening to all of you. Today, we are going to take this challenge of ophthalmology. Well, as we all know, ophthalmology is a highly scoring subject in INACT as well as Neet PG exam. At least 15 questions are expected in INACT and at least 10 to 12 questions are expected in the Neet PG. If you do all the questions correct, you will get a good score and it will take your rank up. So let's begin with the first question. Transducin. Now, this transducin is a protein found in A. glomerulus, B. retina, C. skeletal muscle, D. adrenal medulla. This transducin is found in rods, so it is present in the retina. So the correct option here is B. What more things you know about transducin? This transducin is a heterotrimeric G protein that is naturally expressed in the retina rods and cones. It is a heterotrimeric transducin. That is, heterotrimeric means alpha, beta, gamma subunit all are present. It is activated by conformational change in rhodopsin due to absorption of photon by rhodopsin's active group retinal. This activation causes the GDP bound to alpha subunit. The GDP bound to alpha subunit to be exchanged with GTP from solution and results in activated alpha dissociating from beta gamma. This active transducin alpha then causes cyclic GMP phosphodiesterase to increase its activity, thereby lowering the concentration of cGMP, which is an intracellular second messenger molecule. Now, this decrease in cGMP concentration leads to closure of cGMP regulated Na plus and Ca2 plus ion channels and a hyperpolarized membrane potential. This chain of signaling event is also called as the vertebrate phototransduction cascade. So this transducin is a protein which is found in the rods and cones of retina. So the correct option here is B. Treatment of Moran's ulcer is A. Corneal graft, B. Immunosuppression, C. Immunosuppressives, C. Topical steroids, D. All of them. Now, what is a Moran's ulcer? Moran's ulcer, it is a severe inflammatory peripheral ulcerative keratitis. It is a severe inflammatory peripheral ulcerative keratitis. It is a chronic serpinges or rodent ulcer. The treatment of Moran's ulcer is topical corticosteroids, immunosuppressives with systemic steroids like cyclosporin, soft contact lens, lamellar or full thickness corneal graft. This Moran's ulcer is a rare idiopathic ocular disorder that may lead to blindness due to progressive destruction of peripheral cornea. Although the etiology of Moran's ulcer is very poorly understood, recent evidence suggests that the pathogenesis of this disease appears to be a result of an autoimmune process directed against the molecules expressed in corneal stroma. Moran's ulcer is also defined as a special and the most common type of peripheral ulcerative keratitis. So the correct option here is D, all of them. Which of the following condition is associated with the development of posterior staphylomas? A. Pathological myopia, B. Retinoblastoma, C. Acid injury, D. Sympathetic ophthalmia. A. Pathological myopia, B. Retinoblastoma, C. Acidic injury, D. Sympathetic ophthalmia. This posterior staphyloma means posterior outpoaching of wall of the eye. It is an important component of diagnosis of pathological myopia. Indeed, it is one of the hallmark of pathological myopia. With the exception of inferior staphyloma related to tilted disc syndrome, it does not occur in pathologies other than the pathologic myopia. Thus, the presence of staphyloma is specific, posterior staphyloma is specific to pathological myopia. So the correct option here is A, pathological myopia. Fundus fluorescence angiography done in a patient with cataract surgery shows flower petal pattern. Here you can see flower petal. It appears like a flower petal pattern. What is the most likely suffering from? What is the patient is? A. Macular hole. B. Cystoid macular edema. C. Central serous retinopathy. D. None of them. Well, the correct answer here is correct answer here is B. Cystoid macular edema, flower petal pattern. Features of cystoid macular edema. What is cystoid macular edema? It refers to a condition in which there is fluid accumulation in the honeycomb-like spaces of outer plexiform and inner nuclear layers. Fluorescence angiography done shows leakage of fluorescence dye from the perifoveal retinal capillaries and peripapillary region and accumulating in a flower petal pattern around the fovea. It most frequently occurs following cataract surgery, especially if the surgery was complicated or prolonged. It usually manifests at 4 to 12 weeks post-operatively. So it is cystoid macular edema. Kaiser-Fleischer ring is seen in which layer? From the image, you can see a Kaiser-Fleischer ring. Now, this Kaiser-Fleischer ring is found in which layer of the cornea? Kaiser-Fleischer's ring take the form of a crescentic, dusty brown discoloration of the deepest layer of cornea, which is the descement membrane. So the correct answer here is descement membrane. Placido disc is used for diagnosing which of the following condition? Placido disc is used for diagnosing which of the following condition? Placido disc examination is used to diagnose keratoconus. In a case of keratoconus, placido disc examination shows irregularities of the circle. What is placido keratoscopy disc? It is a disc painted with alternating black and white circles. It may be used to assess the smoothness and curvature of corneal surface. Normally, on looking through the hole in the center of disc, a uniform sharp image of circle is seen on the cornea. Distortion of circle occurs when irregularities are present on corneal surface. So the correct answer here is keratoconus. Laser used to manage after cataract is A. Excimer laser, B. Argon green laser, C. Diode laser, D. Nd:YAG laser. Well, it is Nd:YAG laser. Macular sparing is associated with the lesions of A. Optic nerve, B. Lateral geniculate body, C. Occipital cortex, D. Optic eyes. It is occipital cortex. Satellite nodules, you can see in the image clearly, is seen in A. Fungal corneal ulcer, B. Tuberculosis, C. Sarcoidosis, D. Viral ulcer. Well, it is tuberculosis. Sorry, fungal corneal ulcer. Herpetic keratitis is treated by A. Analgesics, B. Atropine, C. Steroids, D. Hydroxide. It is hydroxide. An elderly male with heart disease presents a sudden loss of vision in one eye. Examination shows a cherry red spot. The diagnosis is acute ischemic aortic neuritis. There is a 2-day ultimate NEET PG, a rapid revision breakthrough blueprint Click the link in the description box to join this wonderful class. It will make your preparation so easy that you will be able to mark the answers in the real NEET PG exam easily, naturally, and automatically. Let us move to the next slide. Osseous ring. Osseous ring occurs in A. Lens dislocation, B. Concussion injury, C. Penetrating injury, D. Extracapsular extraction. Here you can see the osseous ring. It is seen in concussion ring. Mucin layer tear film deficiency occurs in A. Keratoconjunctivitis sicca, the dry eye, B. Lacrimal gland removal, C. Canalicular block, D. Herpetic keratitis. Well, it is keratoconjunctivitis sicca. Soft contact lenses are made of A. Polymethyl methacrylate, B. Hydroxymethyl methacrylate, C. Glass, D. Silicone. It is hydroxymethyl methacrylate. Golden horse syndrome is associated with which prominent macular manifestation? A. Microcornea, B. Megalocornea, C. Sclerocornea, D. Epibulbar dermoids. Well, it is epibulbar dermoids. Type of collagen present in cornea is it is type 1 cornea. L-shaped pearls are a sign of A. Chronic uveitis, B. Secondary cataract, C. Cystoid macular edema, D. All of them. It is secondary cataract. These L-shaped pearls are seen in secondary cataract. Rosette cataract is seen due to, well, it is trauma. Eales disease is recurrent periphlebitis retini. You can click the link in the description box to join the 2-day ultimate rapid revision NEET PG breakthrough blueprint covering all the 19 subjects. Click the link in the description box and you can join it. It is absolutely free. The earliest change noticed in hypertensive retinopathy is A. Soft exudate, B. Arterial spasm, C. Venospasm, D. Hard exudate. It is arterial spasm. Darlim's sign of ocular Graves' disease refers to A. Retraction of upper lid, B. Lid lag, C. Proptosis, D. All of the above. It is retraction of upper lid. Best method of detection of retained glass intraocular foreign body is CT scan. Isolated painful third nerve palsy is a feature of aneurysm of ophthalmic artery. All of the following are true about sympathetic ophthalmitis. A. Affects the injured eye. B. Mostly results from penetrating wound. C. Autoimmune deficiency. Dallen-Fuchs nodule may be seen. Except affects the injured eye. It affects the opposite eye. Diabetic cataract is due to accumulation of sorbitol.